People here. Thank you all for being here. Good morning, good afternoon, good evening to all. Thanks for joining us. I'm Sean Carroll. I'm on the executive board of PQMD as the treasurer, and in my day job, president and CEO of ANERA. And so on behalf of the PQMD staff and board, I'm very grateful and honored to be welcoming you here today on to take the time to join us for this PQMD pillar talk on impact and sustainability, setting and achieving incremental goals when funding is finite. For those of you, and I don't think there are many, but for those of you who may not be familiar with PQMD, we're a global alliance of international NGOs and leading healthcare companies committed to advancing the breadth and the wealth and the quality of product donations worldwide. Founded 25 years ago, our work is guided by 6 pillars: humanitarian assistance, health systems strengthening, disaster response and preparedness, guidelines on product donations, knowledge management, and climate and health. And today I'm proud to say that the work of PQMD and our members is really central to the global response to universal healthcare efforts by promoting sustainable access to quality healthcare in underserved communities and displaced populations in crisis. Very quickly, just want to review some housekeeping rules for us. Please type your name, as many of you already are, into the chat box. Let us know your organization. We'll ask you all to remain muted, but do invite you to use the chat box for questions and comments. And if it's a small enough group, and Jenny, our moderator, agrees, I'm happy for people to raise their hand and come off mute and ask a question, but try to use the chat box first. The session is being recorded, and it will be posted up on PQMD's Community of Practice this week so that you can see it, or you can let others know who regretted missing it, that they can see that recording. Now I've got the pleasure to introduce Jenny Sia, who will be our moderator today. Jenny's the Director of Global Health and Social Impact and leads global health grant making and impact investing for Pfizer and the Pfizer Foundation. So she's responsible for the Pfizer Foundation's health system strengthening efforts to improve access to quality healthcare for underserved populations around the world, central mission of PQMD. So that resonates with us. Very lucky to have us guide us through this conversation today. Thank you all for joining us, and I'll turn it over to Jenny. And I'll just like to say, on a personal level, I always welcome this conversation on sustainability and the impact, and say that I also feel that we have this conversation over and over again about how we have sustainability, how we measure impact when we're talking about ESG. And I do think there's a hunger for sort of getting beyond saying, how do we measure this? And actually saying, look, we kind of know what's the right thing to do. What are all the pieces that need to be thought of at the same time for us to really be having positive impact on the communities we work in? So I really look forward to hearing from all the panelists on not just how do we set this up, but actually how do we already know what needs to be done, and we're actually implementing that. So over to you, Jenny, and thank you all for being here.
Great. Thank you, Sean, for that introduction. And I think such a perfect way to lead into our discussion today. Good morning, good afternoon, good evening, everyone. As Sean said, I'm Jenny Sia, and I'm really excited to be here to moderate this discussion today. Since what seems like the dawn of time, or at least the dawn of development work, sustainability has really been both a goal and a tension at the center of everything that we do. And in a world where resources, where personnel, where stakeholder attention, and even government support are all finite, program sustainability and being able to make lasting and important sustainable impacts for the communities that we are serving is not only never a guarantee, it's something that needs to be prioritized and worked for through all partners in different projects. It needs to be part of program design. It needs to remain an area of focus throughout the implementation of a project. And it needs to be reflected in programmatic goals and monitoring and evaluation frameworks. So it really needs to be at the center of what we do and how we conceive of the work that we're trying to do. And so today we really wanted to talk about basically how funders and implementers help to invest and advance strategies that deliver long-term value, that can support capacity building efforts that outlive the implementation of a project, and most importantly, how we put a focus on resilience and ownership for local communities of the work that we're doing through the entire process. And while that can sound like a clear path, we know in reality that driving sustainable outcomes can be a lot more complicated and rarely take a linear path. Donors, and as I speak on behalf of some of them, increasingly understand, I think, the need for more flexibility in funding and in partnership processes, but oftentimes the systems within we work can make that more difficult to realize. I think implementers need a clear understanding of the context and the landscape that they're working in, the stakeholders and even the stakeholder transitions that will happen, and also the flexibility within their partnerships to be able to adapt program design and partners over time. And all of this happens, as we know, against a changing and sometimes chaotic backdrop of governmental, social, and economic priorities and events that are happening and unfolding around the world. So of all the issues that PQMD members deal with, I know this is one that's central and shared throughout our community because there are so many different implications on different sides of how actors and partners will react to some of these forces. We also know that there is a wealth of experiences and perspectives in this group on what works. And so rolling up your sleeves and understanding how to craft these partnerships with an eye towards driving impact and sustainability, and how to help realize that, that impact down the line. So in the spirit of wanting to kind of bring, that's the spirit that we want to bring this session together and hear from our panelists, as well as all of you about your experiences on the sustainability journey. And so today, we're joined by 3 implementing organizations who are going to share examples of programs they're leading with different consortiums of partners. And we're going to dive a bit into their experience, share some of the best practices and insights that they've gleaned through this work, and tackle a range of topics in the discussion, from program design to impact measurement to stakeholder and partner management over time. And so we really want to hear from our panelists, but also hear both questions and feedback from you. So we're going to have short discussions with each of the panelists and then open it up. So please, as you're listening to the panelists, if there are questions or comments that you want to make, please put them in the chat. We'll be checking the chat and trying to address some of those as we go through, and then we'll have some time for round robin. So we're going to jump right in, and I'm just going to give a very brief introduction of our panelists. We're going to put their bios in the chats because we are short on time and they are very long on experience. So we're very excited to have them with us. But we have Dr. Mencia Ripley from Universidad Iberoamericana of the Dominican Republic. We have Dr. Andrew Kambuga from the Infectious Diseases Institute in McCary University. And we have 2 representatives from CMMB who are going to be joining us in our discussion as well, Yambo Tenguano and Darnell Bernier. So we're going to start with Dr. Mencia. We can get her spotlighted. Perfect. And so Dr. Mencia, maybe start and kind of set the context for us a bit by sharing a partnership that you've been working on with Seeding Labs. Give us a little bit more of that background and overview of the partnership.
Sure. We started working with Seeding Labs in 2016. We proposed to our university board to create a research institute focused on global health, and specifically concerned with some of the endemic diseases that were not attended to in our country, but also with the concern of future outbreaks of new infectious diseases. Little did we know that unfortunately this would happen a lot sooner than we expected. So it was a bit of a perfect storm in the sense that there was already substantial university investment and understanding on why this was very important for our country to do and important for universities to take a lead on. And so it allowed us to work with Seeding Labs in a way that ensured sustainability, that it wouldn't be sort of a one-time donation that then we would struggle to maintain. And we immediately worked with Seeding Labs in obtaining equipment that would allow us to make a bit of a leap and grow in terms of our research capacity. Also ensure that the university had the infrastructure to support that, and also insert it into academic programs. So it was crucial for us that this immediately had outputs in terms of capacity building, initially at the undergraduate level, but now thanks to that initial work that we did together in 2016, that sustained effort allowed us to open a doctoral program, have the necessary infrastructure to open what's actually one of the first doctoral programs in health and behavioral sciences in the country. So I think being able to gather all those stakeholders from the beginning and ensure institutional support and country support was crucial. We did quite a bit of work with seeding labs as well, and the research areas that would benefit from this donation, and made sure that those were areas that were compatible with state research funding, to also make sure that this would allow us to continue to win grants, to continue to support the work of the Institute, which has been quite successful so far.
Thank you so much for that overview. And there were a couple things that jumped out at me, but first was really this focus on long-term capacity building efforts and using what was kind of initial programmatic support, as well as some support that was delivered in kind of an emergency response efforts of thinking about COVID and other infectious diseases. So could you just talk a little bit about, in a little bit more detail, about the focus on long-term capacity building efforts with the doctoral program and other elements, and how that was kind of key to the sustainability of the program from outset, and some of the things that have really kept that focus?
Yes, sure. And again, we received an additional emergency response donation when COVID started. And this was really, really important, because we were then able to become a partner to the government's COVID response. And that was really, really crucial, because precisely we needed more staff with the skills to be able to contribute to this response. So we became a strategic partner to the government in ensuring that we had enough trained personnel capable of meeting the demand. What we were also able to do, thanks to how this partnership developed, and once we demonstrated our capacity building programs and our strategies, that's what really boosted us in terms of the doctoral program. We maintained that strategic alliance with the state, but post-COVID, we shifted it more to understanding where the gaps in training were and what the system needs to better function. And an interesting thing that just happened with our doctoral program is that the first cohort has a full government scholarship. So we've been able to build a very, very good functioning relationship with the private sector, but also with the state, and build a lot of trust. And this is what ensures that things are sustainable. The university has commitment, but we all know that academic institutions, especially in developing contexts, have quite a number of challenges. But the fact that we were able to demonstrate what we can do, thanks to what Seeding Labs did, allowed us to build trust, where now the state feels that we are a valid partner that they can trust for capacity building. This ensures the sustainability of our doctoral program. And the idea is to not only continue building with more scholarships to train doctoral level scientists, but this has also led the private sector to become interested in investing in us.
So you've touched on something that I know is going to be reflected through a lot of this discussion, which is sort of the importance of trust in partnerships. And I think, any long-term partnership, that trust in that working relationship is really at the center of that. But oftentimes we know there are different layers and actors coming into to partnerships, particularly that exist over time. whether that's government transition or just changes in leadership in different organizations. So from the perspective of an academic organization, can you talk a little bit about sometimes the role that longer term partners or academic institutions in particular, because we have several on the call, can play in helping to navigate different transitions in partners or government priorities or just transitions over time, and how really academic organizations can help to underpin that?
Yes, and I mentioned the experience with a number of other projects that the university has done, where the government institutions have significant changes in leadership during the life of the project. So the fact that these very, very impactful programs, not only for training, but also for communities who receive services thanks to these programs, can continue to receive those services without interruption due to political circumstances, is precisely because academic institutions can provide that continuity. But again, that requires that the state trusts us and listens to us. And so what we've been able to do is propose mechanisms of collaboration with the state, and also bring private sector partners to really strengthen those relationships and ensure that political change doesn't destabilize these programs. Another thing that happened thanks to what we were able to do with Seeding Labs during the pandemic is that we were able to really contribute to science diplomacy and the foreign service in our country. When our country was speaking to other countries about how to collaborate with COVID response, because we had this installed capacity, we were able, as a country, our diplomats were able to better position our country in terms of more equitable partnerships. And we got actually some great feedback from the diplomatic corps, in the sense that it wasn't sort of the traditional give us aid as a developing nation conversation, because we had installed capacity, we were delivering COVID testing, but we were also doing science, and we were doing sequencing, and we were doing really, really important work that it allowed our national decision makers to better position the country. And that's I think incredibly important, and something to highlight with this collaboration with Seeding Labs, that it's allowed us to establish more equitable win-win relationships with foreign partners.
I think that's such an interesting point to end on, because it brings together a lot of what we'll be discussing, and also I think the importance, as you noted, on trust, but also the impact that you were able to deliver and demonstrate. And so as we're thinking about sustainability, and the importance also of being able to demonstrate the impact and the capacity that different projects have delivered in building trust with communities, but also, I think it's interesting putting you on a level playing field for more equitable discussions in global dynamics, which is such a critical, an area of critical importance we've seen over the past few years. So, really, sustainability and impact and trust all wound together in a very kind of a very important web. So, Andrew, maybe I'll turn to you, and would love to have you start and maybe give folks an overview of IDI and what that sustainability journey, has looked like.
Great, thank you, Jenny, and appreciate PQMD for this opportunity to be part of this conversation, and was listening very closely to Dr. Messia's submission, and will highlight some of the things she's also mentioned. So I am based at the IDI at Makerere University, and the IDI today is a thriving health sector NGO in Uganda and the region. It has 6 strong programs, through which it's a leading implementing partner for HIV and TB. Increasingly, it's a dominant contributor in what is called the global health security space, supporting responses to entities like COVID-19 and Ebola. We have supported a lot of faculty development at the university, and particularly for the College of Health Sciences, the scientists who utilize the infrastructure at the IDI are really some of the most young professors, most young and most productive professors. And also increasingly, the idea is emerging as a model within the university that other specialties within clinical and medicine and public health are emulating. And I start there because what I would like to relay is how this 20-year-old entity is in what I would think is quite a favorable position, despite a beginning that was filled with a lot of uncertainty. So I know, Jenny, you said that these paths are hardly linear, but I will just describe very briefly three phases of IDI's journey. And I think even as I dive into this, the word trust that Dr. Mesia mentioned is very important. So the foundation of IDI is really an international public-private partner responding to a local need. So as many of you know, Sub-Saharan Africa was hit with the HIV/AIDS crisis, which was at its height in the 80s and 90s, and Uganda was one of those focus countries. And this occurred in a setting where some Ugandan and American academics were already doing some collaborative research. But I think what really sparked off the IDI was the power of private sector, in this case, Pfizer. So these academics, through their networks, were able to mobilize initial resources that led eventually to the founding of the Institute. And what I want to relay is how that initial setup really was set up with sustainability in mind, and maybe to draw some lessons. So one aspect of that is that the Institute was set up within the university intentionally. Makerere University is over 100 years old, and I do think that setting this up within the broader framework of an institution really laid some ground for the sustainability of what IDI has continued to do well. And of course, we have benefited immensely from the brand of the university. But, you know, it was also set up within Makerere, but with very unique governance arrangements, which essentially gave the Institute what I call operational autonomy. So the management of the Institute has its own governing board, and the university management does not interfere in the day-to-day management of the Institute. And I think that placement within a university, but giving it some special autonomy to operate, was very important for the success of the work we do. So things like hiring staff, procuring things is much efficient compared to the conventional university systems. But the other facet, and I think here, because we have donors on this conversation, is that the initial investment from Pfizer was unrestricted. So the founders could fashion those resources the best way they could. And I'm glad that a lot of those resources did not go into routine expenses, but really laid the foundational systems for the institution, including, of course, the governance arrangements, setting up the company as setting up the Institute as a company within the university, but also setting up robust financial and HR mechanisms, key vehicle for trust. So, you know, people providing resources to us can trust that those systems will deliver the resources where they're needed most. So in that first phase, I would say that unrestricted provision of a grant was very foundational in establishing very good systems. The next phase of IDI's growth, which happened between 2012 and 2016, was really consolidating our position, but also taking some calculated risks. I'll just cite one example. A lot of our initial programs were within Kampala, where the university is based. And at one time we had a conversation that we should really take our services, the care and treatment, the research, to more peripheral parts of the country. And I can tell you, at the highest organ within the university, there was a very strong debate about what a university is doing in communities. Deep down, the university should be training, giving doctoral programs and research. But we really made a case that for us to address challenges like HIV/AIDS, we really needed to learn from the trenches. and were successful in convincing the university that there's a place for university deep down in the community. And that has given us a lot of visibility, credibility, trust, and that has laid the foundation for the third phase of IDI, which is around expansion. So I think it's notable, just before I conclude, that the initial Pfizer investment was time limited. That investment was coming to us through a North American entity, and Victoria, the relationship with Victoria is through that entity that was called Accordia. And that investment, from the very start, we were told that it would come to an end in 2012. And so the funding was calibrated downwards up to that point. I think it's pleasing to see that in 2024, which is 12 years after that, the cessation of that initial support, IDI was able to intentionally grow its own business development function that now enables us to raise $65 million every year. And a lot of this is competitive. And so I think here there's a very interesting model where we were able to win off a generous donor, but also build muscle to compete for resources across different diverse geographies. So North America, Europe, and other entities. So I am mindful of time, but I've tried to really summarize in a very short time what has been a remarkable journey. And I have had the opportunity to watch it closely over the last 20 years. Thank you.
Well, Andrew, I was just reflecting too on the past 20 years and being able to watch the work that has happened at IDI, and it's been really a great privilege on my side. And you mentioned with Victoria's previous role, it's all in the family here, so we're excited to have you present. And you actually covered it well. I was going to ask you a question more about kind of how, when IDI was conceived and sort of you described it as an institution inside an institution, and really thinking about how the structure of the public-private partnership really was built from the beginning to try to address issues around sustainability, knowing that that some of this, the grant funding would come to an end, and really, you know, how much time was spent in thinking about setting those systems up for sustainability. And I think it'll be something that comes through as well, this theme of long-term partnerships really needing that focus on sustainability from the outset all the way through to the end. So that was a question I was going to ask. I think you covered it well, but wanted to note it for the audience. Maybe one question for you really on your programmatic scope at IDI and how it has adapted and evolved. So you outlined kind of the initial focus on HIV, but over time, the institute has really grown to address so many different areas of infectious disease. And so could you talk a little bit just about that journey as well, and sort of your ability to use those core sets of skills to expand your partnership base and your programmatic focus?
Yeah, thanks. I think the strand I want to kind of extract here is, I think part of sustainability really is around strategic planning and scanning the environment for opportunities, especially for us in the global south, because, you know, you really have to have a diverse funding portfolio. So it's true that we started our work with HIV, and there was a lot of need for that. But a lot of progress was made in the last decade, and many people getting on treatment, and we started seeing the numbers getting new infections actually dropping by 50%. And I think that occasioned a lot of internal questioning, like what more can we do? Because we've established systems, we've established relationship, trust, and we could leverage it and pivot it for new disease areas. So around 2015, we, as part of the environmental scan, we did note that Central and Eastern Africa is a hotspot for emerging infectious diseases. And so we started thinking about entering this space. And we really didn't have much technical capacity. But I think the point here is you have to make some bets, you have to take some risks. So I remember us making faltering steps, applying for funding here and there. Eventually, we got a multi-year grant from the US CDC to do some work around surveillance of febrile illnesses. And this multi-year grant enabled us to slowly build capacity to really support the government to prevent, detect, and respond to these threats. And by the time COVID-19 emerged, I think it's fair to say that IDI was one of very few local, Ugandan entities that could support and sit with the Minister of Health to really anticipate and plan for the COVID outbreak. And subsequently, when Ebola also emerged in Uganda, the Institute was in a strong position to do this. I think the final comment is that we did leverage a lot of capacity that was built using resources from PEPFAR. So here, it's an opportunity to also to thank the US taxpayers on this call. That program really has been monumental. We have leveraged it, whether it's lab infrastructure, or supply chain, data management, to pivot into these newer areas. So it's really, we have been opportunistic in doing this.
I think calling out the importance of long-term commitments wherever they come from in helping to advance this work. But again, I hear a lot, trust and impact being an ability to demonstrate your impact being these critical elements that are driving sustainability moving forward. And so, Yambo, maybe I'll turn it to you with this in the spirit of long-term programs that are driving impact and sustainability. Can you start off by giving us an overview of the CHAMPS program and talking a bit about what that program is delivering and kind of the history and evolution of that work?
Thank you, Jenny, and thank you, Muncia, and thank you, Andrew, because I am going to rely on what you've already provided to really drive my own discussion. CHAMPS stands for Children and Mothers Partnerships, essentially a call for renewed attention and commitment to maternal, newborn, and child health. If you will, it's CMMB's program model to improving the health and well-being of mothers, newborn, and children in communities with some of the worst indicators. Let me just piggyback on what Andrew was saying to say we grounded this model in really three things. One, in our belief that people want, fundamentally, people want to be healthy. Everybody wants to be healthy. Even during COVID here, when people were reluctant in taking the vaccine, it's not that they don't want to be healthy. Everybody wants to be healthy. So our belief that people want to be healthy, and when they're not healthy, they want to be well. We also ground the program, the CHAMPS model, in our trust. That is where the trust comes from. We trust in the communities where we serve. We trust that they may be vulnerable, but they have assets and resources without which nothing impactful or durable can be achieved, right? And then third, we also ground the model in our conviction that it's only through their trust, their ownership, their leadership, that a program can be delivered with dignity and sustainability. The model is implemented in 5 countries: Haiti, Kenya, Peru, South Sudan, and Zambia, where each CHAMPS serves a cluster of communities with population ranging from 20,000 people, like Peru is very small, to up to 400,000 people. The technical approach is, if you will, CHESS, which stands for Community Health System Strengthening. It entails the use of data, local data, contextual data, global evidence data, etc. So the use of that data to prioritize and strategize the ways in which we enable health, not just at the facility, but also in the community, so that you can mobilize people to go to the facility. And in the process, you really are galvanizing them in leading their own health, because it's only through them that you'll have an uptake of integrated health for the long term. The core program areas for CHAMPS obviously include child health, critical child health areas, and critical maternal newborn health areas. I mean, for some of us who have been in that area, you know, critical child health areas is like malaria, diarrhea, especially in the areas where we work, nutrition, immunization. And then on the maternal spectrum, we have, you know, antenatal care, the pregnancy care, the newborn care, the postnatal care. But then in the middle, we have community-wide areas such as water and sanitation, nutrition, livelihoods, and HIV and COVID. So when COVID hit, these are kind of community-wide interventions that they don't just fit mothers or children. It's for the community at large. And so we have programming like water and sanitation that, thanks to the partnership of you know, organizations like BD, or immunization support, thanks to organizations like J&J. And also under the maternal health, we also support cervical and breast cancer. And this is thanks to organizations like Bristol Myers Squibb Foundation. So essentially, in its approach, we simply always say that CHAMPS is a service delivery improvement program through which we build capacity of systems and people for the long term. I can give one highlight and let you lead to the second question, which is Chisu is one community in Zambia where we intervene in the western area. It's one small community. When we started maybe 7 years ago, it was 0% ANC1 within the first trimester. If we ask even in the US, maybe not in the US, but across the globe, what is the proportion of ANC1 within the first trimester? That's a challenging indicator. This little community in Zambia just achieved in our last quarter 3, 100% of ANC1 within the first trimester.
That is impressive. When we talk about impact and being able to sort of realize impact over time, to see that is, I think it is incredibly impressive, and being able just to have those data points that demonstrate so clearly the effectiveness of the work. So, you know, you've, I think, laid out so much of what the CHAMPS program is trying to deliver. I wonder, can you talk a little bit about some of the ways that the program has evolved, but some of the kind of most important characteristics that you think are driving sustainability and uptake? You know, you talk a lot about kind of community rootedness, which is such an important part of making sure both the interventions are tailored to the community, but there's community ownership. So I'd love to hear just a little bit more about some of those some of the ways the program has evolved, but what you also think the characteristics that drive success.
Thank you. So I will start with the characteristics and kind of link back to the 3 centers of interventions that make up CHAMPS, which is you have the data component, you have the community component, which is community health workers. A lot of organizations work in that area. We work to strengthen community health workers. One of our successes during COVID was because we had already built up a strong community-based health system that can just take the package and we can adapt it and have them mobilize, raise awareness about COVID, social distancing. We already had a platform. Community health services, community health programs are so important to primary healthcare system, to national healthcare systems, especially in low resource settings. So one of the sustainability characteristics is our community health worker program. We go in there, we work with community members, and they lead. So when you talk about community health committees, these are farmers, fishermen that make up a committee and say, we now understand some of the key health indicators that we need to push. That Chisu example that I gave you, this is a result of NAC. It's a neighborhood health committee. It's a version of community health committees that stepped in to say, we will make sure that every woman can have access to go to the facility to do ANC1. They provided ox-driven carts because it's sandy. You can't put a 4x4 there. They mobilized and provided that, but say, we will provide the resources to take you there. If you don't go, there is a fine. So that is kind of a localizing, contextualizing, and letting the community, the local communities themselves, take the lead. So that's one feature. The second feature is that we also kind of work within the policy framework. In South Sudan, for example, you have to work with the national, I mean, everywhere you have to work with the national health planning. We are not supplanting the health system, right? We come in and we say, let's look at the framework. Let's look at the quick wins for maternal, newborn, and child health. And so if we are able to drive something, that stays. We influence the community health worker policy in South Sudan. Right now, they have a national community health worker policy that wants them to be paid, supplies, supervised, etc. We can take some of the credit for that. This is called the BHI. I believe that's a kind of good way to capture the characteristics. I think in terms of evolution, I can give you the example of Kenya, where we started directly implementing. So we were direct implementers covering about 190,000 people catchment. Community health workers and healthcare workers, we were directly paying that. Jenny, to date, and that was just in one sub-county of Kenya. In Kitui now, the entire model has been scaled up to the 6 sub-counties. And CMMB doesn't pay the community health workers anymore. That is how we have evolved from implementer to now we provide technical assistance.
I think that's a fantastic example. And I think as you've pulled out the characteristics, some of the characteristics that have been important in sustaining that journey, the policy element is definitely one, and the importance of sort of policy engagement, because governments are going to be stakeholders and funders and overseers of so much of this work. And so really trying to be in lockstep around the issues around policy and implementation on the government side. But I also was struck, we've talked a little bit about the importance of trust and impact. And in your retelling, really thinking about trust and impact, not only with the stakeholders in our consortium, but the communities where we are serving. And that is fundamentally important for probably the most important piece in really looking at sustainable programming, is being able to demonstrate over time to communities that they're a part of this work and that we're going to help to deliver on some of the things that are most important to them. So I think an excellent spot to start to think about the future. So before we move on to the round robin, I wanted to bring in your colleague Darnell, who's going to talk a little bit about using some of the lessons that have come out of CHAMPS. How does this inform your future programming, and kind of how does this shape the way that CMMB is thinking about new programming and what needs to be in that programmatic design for sustainability?
Thanks, Jenny. Really appreciate all the contributions and what's been shared by all of the panelists. As Yamba was describing, we have seen successes through the CHAMPS program model. And so CMMB is looking to apply some of those, some of that structure for approaching medical donations in a new way. We have over a century of experience and a history of distributing a wide variety of medicines, which is our focus. But now are seeking to utilize data, as was done with CHAMPS, working with the community, understanding what their desires are, and then applying the resources that we have access to, which is the generous donations of many of the PQMD members, but to have a targeted impact. looking at NCDs specifically, partnering with local ministries, and agreeing at the outset that while we can help support increasing access to treatment for some chronic conditions, hypertension, diabetes, lower respiratory infection, that we will incrementally transition that over to the government as CMMB did with CHAMPS and the community health workers, the community health promoters, as Yambo had described. So it's looking in new ways to create more sustainable streams to access to treatment based on successful models that we have seen before.
And I'm so glad we got a chance to touch on this, because I know it is an issue sort of central to a lot of our PQMD members, in that they do a lot of gifted kind donations, and knowing that they're critical and important, on the medicine and vaccine side, critical and important health commodities, and wanting to make sure that there is planning from the beginning on what will happen when those donations are no longer available. And I love this idea of sort of this incremental moves towards sustainability, and knowing it's not we can't flip a switch and one day all of a sudden programs are sustainable, but how do we keep this as a focus throughout the entire program? And I think rightly so, you call out making this clear from the beginning. And so all of the stakeholders and implementing partners are kind of on the same page about where we are and what shared activities are needed to help to ensure sustainability. And so that really moves me to the round robin. But before we jump into any questions, I wanted just to open it up to the group and see if there are anybody wanted to come off and perhaps either share an experience or has a question for the panelists before I get to jump in with more follow-up. All right, I see Jean-Claude, I see a hand, please go.
Yeah, thank you very much, Jenny, and what a wonderful presentation. Just a quick question to Iyombo. It was quite interesting to hear that in the first antenatal visit, you actually achieved 100% in Western Zambia. That is really tremendous, because that is an indicator we always fail to achieve in most of the countries. I just want to know, what did you do to convince all the men in that area to let their women go for that first antenatal? Because that is actually one of the major challenge in those most African countries. Over.
Jean-Claude, I wish we had 2 days to chat about this. But we don't. But I think it's the million-dollar question. How do you even get the women themselves? Because let it be told that in some cases, women have sought services at facility and they've died in the process. So we have also that baggage that always can scare women away. They say, well, I deliver with my TBA, I was fine. And then you tell me to go to the facility, it wasn't properly equipped, and I died. So I think let's just put it that there. So there is so much challenge to convince a population that has for so long suffered from lack of access and quality of access to say, this time, trust me. It goes back to the discussion about trust. And how do you instill that? Of your approach you come in and say, how about we just look at what the status of the problem is? Let's look at the intricacies of the problem that you're dealing with. And so in CHAMPS, we call it the gap analysis. It's so foundational, it's so fundamental to each CHAMPS. And you lead it with the men, you lead it with the MOH technical leads, you lead it with the community stakeholders, including those men that you're talking about. So that's one. The second, the NIH, the community health committee members, unfortunately, they are still mostly men. So we get those on board, they become advocates. in every community health committee, at least most community health committees have the chief, the village chief in there. He becomes the super voice, the super male voice or husband voice in that. I don't know if I answered your question, but we can take it offline and chat more.
Sounds like we might have another topic for a pillar talk. Great. So I'm actually just going to ask everybody kind of one question, and really thinking about these ideas of impact and sustainability and monitoring and evaluation are so also intertwined to support this long-term goal of sustainability. So I'm wondering if you could each share a bit about your organization's experience with that. How do you align goals and objectives and measurement frameworks with donors and other partners really at the outset? And how do you use your programmatic impact to support sustainability over time? And I'd also say, we've got implementers here. I know we got a lot of donors on the call. So if there's advice or feedback that you'd also give to donors and funders in this area, I'm sure they would love to hear it. So Dr. Mencia, maybe we'll start with you.
Sure. Yes, for us, actually, monitoring and evaluation has been a major component of this from the beginning, not only for donors, but also to ensure that we retain institutional investment. It's really important to include outputs from these programs into our strategic planning. So there's nothing that we do that doesn't contribute to reaching institutional goals. And that ensures that in the next cycle of funding, we will have support for these programs. The same goes for state partners, to be able to show the actual impact that this is having. So we have a very robust M&E system in the Office of Vice Chancellor for Research and Innovation with standardized indicators. It has also helped us that our country is establishing national indicators for science and technology. So regardless of what your academic or research institution is doing, you have to report to the state how you're contributing to those national goals. I think that the hard work for us has been to reconcile what we dream about in terms of what we can do with communities and what we can do for science, and to make sure that science benefits the most people it can possibly benefit, to sort of reconcile the dream with the very sort of cold, dry numbers that we need to report. And in that sense, we've advocated for more inclusive indicators for outputs for science and technology, the inclusion of community impact as a valid indicator of outputs. Those in the audience who come from universities know that those indicators tend to focus a lot on fundraising, a lot on patents and technology transfer and papers and things of that sort. So we've been advocating through our regional networks for the inclusion of community engagement and community impact as part of the indicators that drive university and researcher evaluations. So I think there's quite a bit of work that we have to do, and in that way also make sure that communities are not forgotten when these things are measured in the long run, and not just in terms of sort of direct or indirect beneficiaries, but what happens further down the line when those programs are not active anymore.
I love that idea of inclusive metrics, and it goes back to the old adage of whatever gets measured gets managed. And so really thinking about the importance of measurement in what we do. Andrew, maybe I'll turn it to you. IDI has a ton of different donors and partners, private, public sector, scientific collaborators. How do you think about impact and sustainability, and any advice you'd give to donors and other partners who want to make it easier for their implementing partners in this area?
Yeah, I think one guiding thought has been having a well thought through strategic plan over like 5-year cycle. The strategic plan helps us really to harmonize all these efforts across different donors. It helps us to align with government. It also allows us to say no in a way that we're not misunderstood and seen as impolite. Picking up on the comment Dr. Mencia made, it's interesting because we also have a two-track strategic planning metrics. So we measure what we do that impacts the communities, but we are also intentional to make sure that we do things that build our internal capacity to be able to deliver on those community things. And you have to actually allocate resources to that. And it translates into conversations around overheads and cost recoveries, which sometimes donors are not enthusiastic about. But, I think I would like to transition to that point that part of sustainability in our considered view is sustaining institutions, because the institutions are then vehicles of action. If the institutions go through a really bad chapter, then it does have impact in terms of specific health indicators. And so taking up the opportunity to speak to donors on this call, our experience has been that it helps to, from time to time, have access to unrestricted funds that then help to bolster systems so that the resources are not necessarily going into direct service delivery, but they're really addressing a very strategic aspect. It may be governance, it might be strengthening internal audit, sub-granting. But, by strengthening the organization, you're also investing in that organization being able to deliver to the community. So I really wanted to highlight institutional investments. Thank you.
Strong institutions deliver strong programs. So it's a great reminder. And Yambo and Darnell, let me turn it over to you for any last words on impact, sustainability, or what you think donors should appreciate more.
My quick word before I turn on to Darnell would be, to donors, I would say, view CHIMPS as a journey. And we have actually framed it, our framework, it's a journey. We approach each community, and CHIMPS is a long-term commitment. This is how we frame it. It's a long-term commitment to redressing indicators for communities. So we come in, and we don't come in for a year or 2 or 3. We come in for, and we have built it into phases. We said every CHIMPS will take a phase of building up, optimizing, making it better, demonstrating impact, that we can use that impact to advocate. And then once we advocate, we can pass it on to either local stakeholders to scale it up or to own it for good. So I think there are 5 phases. We've carved that out. So if you're a donor, go look at CHIMPS, it's a journey, and give it to us as a journey. Darnell?
The last thing I would add is that, we want to be sure that we are not burdening the community with our reporting requests. So one thing that we are investigating now for our new initiative with the medical donations is how to incorporate really accessible technology that will be able to enhance the work, beyond the medical donations of those facility partners, but also be able to provide the data that we can utilize, but that the national ministries of health can utilize and those facilities can utilize. So just being sure that the reporting requests measurement is a benefit to all.
I think that's an incredibly important point, and we know we need to discuss it more. I think this idea, we are all on a journey here, and so we are lucky to be working together and working with our friends at PQMD to help us on that journey. So Victoria, I will turn it back over to you for the last 30 seconds to close us out.
I just really wanted to thank everybody for joining us today. I hope you enjoyed as much as I did this really interesting conversation by people who are doing amazing work, amazing sustainable work. And if you saw, Beth dropped a link in the chat, if you wouldn't mind taking 30 seconds, maybe even 20 seconds of your day, just to fill out the quick survey about today's discussion. And we really hope to see you again next month for our next Pillar Talk. Thank again to all the speakers for sharing your expertise and insights. Really, really, really interesting comments and discussion today. Thanks, everyone.
Great. Thanks, everyone.
Thank you.
Thanks, everyone.
Thanks, everyone. It was a lovely engagement. Bye-bye.
Bye.